Hi, I'm Dr. Mike DiTolla, and I want to take a moment to speak to you about my favorite way to remove interproximal stain, and that's with the Hygienist strip from ContacEZ. You know, as dentists, there's not that many occasions where we have to worry about removing interproximal stain, maybe on a patient who's done some vital bleaching and sees some stain in between. But for our hygienists, this is something they have to deal with 5, 6, 7 times a day, whether it's a prophy or scaling and root planing. And they've got a bunch of instruments designed to clean calculus and stain off the facial and lingual surfaces of teeth. But when it comes to that interproximal contact, there hasn't been a great way to do it up till now. And so the Hygienist strip, a good way to think of it, is as a interdental flexible scaler. And it would be perfect if you had a scaler that could go in between the contact, and that's what the Hygienist strip does. It's 50 microns thick, so it's actually thinner than a lot of brands of dental floss, and it gives hygienists an easy, effective, and simple way to remove that interproximal stain before the end of the appointment. Now, as dentists, if we were forced with removing that stain, I know most of us would invest and buy hundreds of the Hygienist strips to make things easier for ourselves. And I think at times, we're not as willing to give something or purchase something for our hygienists unless they really beg for it. But I'm here to tell you that you know as well as I do, most hygienists are very passionate about doing the best job that they can. And we owe it to them to kind of take the handcuffs off and give them something that allows them to do the best job possible, like the Hygienist strip. And in a day and age where we're getting reviewed by patients online through social media, many patients will often judge their prophy or their scaling and root planing by looking in the mirror and seeing if they can see any stain. We know as dentists that's the least kind of important thing of what we're doing in terms of their periodontal therapy, but often that's what a patient looks at to see and be able to judge whether or not their prophy went well. So let's give our hygienists the ability to remove that interproximal stain. There's no abrasive on this strip, and so we're not removing any enamel, so it's safe, gentle, very easy to do. In fact, let's take a closer look at the Hygienist strip. So you see the perforated kind of Swiss cheese look that you see on the strip itself, and this is the key for being able to remove stain without removing any enamel at the same time. You can see how flexible this strip is. It's very thin. It's only 50 microns thin, so it's actually thinner than most dental floss materials, so it slides in easier than dental floss will in between the teeth. It's not serrated, so you don't have to worry about cutting the gingiva of the patient as you're using it, and can be autoclaved, so it's certainly not disposable either. And we're basically going to just finesse it into an interproximal space and go buccal lingually kind of back and forth, with some gentle force, using it to kind of clean it. So try to simulate a patient here who's just had their teeth cleaned but still has interproximal stain. So you can see this stain, and it often comes from coffee, tea, tobacco, and red wine. So as we're scaling or using the piezo scaler, we can get all along the facial, we can get all along the lingual, but then all of a sudden we've got these interproximal areas where you can just barely see that discoloration, but you can't get a scaler to it. You really can't get anything to it because it's in the contact, and that's where the Hygienist strip really comes in handy. And your hygienist will love it because it gives them the ability to clean something that they really didn't have an instrument designed for it, and therefore it was almost impossible for them to clean it. And like it or not, a lot of patients kind of judge how good their cleaning was based on how their lower 6 and upper front 6 teeth look, regardless of all the work you did in their 4 and 5 millimeter pockets in the posterior. So again, we're going to use it. It's not serrated, so you don't have to worry about hurting the gingiva, but just buccal lingually back and forth. And because of the flex, you can see I'm pushing towards the mesial here and then pulling back away from the distal of that tooth to the mesial of this one. And you'll notice when you get a chance to do this, whether it's on a model or whether it's in the patient's mouth, that you can feel compared to any of the other strips that there's definitely no cutting taking place here. In fact, it doesn't feel like you're doing anything, to be honest, when you use this on a patient. You'll kind of wonder, except for the stain disappearing, you will wonder whether or not it's actually working as you go back and forth. And so those serrations, those little Swiss cheese holes in there, are enough to grab any stain that's there without actually removing any tooth structure at the same time. So most of the hygienists that I've met in my lifetime are very passionate about doing the best job that they can for their patients. And they've always been kind of frustrated at their inability to get down at these interproximal areas where they couldn't fit a scaler or anything else. And the Hygienist strip, which Dr. Kim invented for his own hygienist to help her frustration with trying to get in there, has become something that we use. I use it on the dental side of the office anytime a patient is doing vital bleaching and you can still see that hint of a stain interproximally. Do yourself, your hygienist, and the patients a favor and just get your hygienist the Hygienist strip. Don't wait for their birthday. Don't make them wait for Christmas. Just invest in this simple little product and let them start getting the results that they're trying so hard to achieve otherwise. So on behalf of myself and everyone here at ContacEZ, I want to thank you for your time and your continued commitment to quality dentistry.